Thank you for being here today. We are going to talk about idiopathic. What does that mean exactly? And have you ever heard it? I know I've heard it, and long time ago, I didn't really know exactly what that meant. It was just a fancy medical term. But over the years, I have learned exactly what that means, and I've had providers tell me that, and I have heard that phrase or similar wording or verbiage said to family members, friends, clients, and it really aggravates me. And I want to talk a little bit about what it really means if you hear it and potentially what you can do about it, or just questions you can ask to maybe get some answers. So I got thinking on this subject because I was scrolling social media, and there are some people that I follow that will sometimes share, things about their life, and some person that I follow is not like in the medical field or the counseling field, just some social media influencer, and they were sharing about some of their medical experiences, and it sounded an awful lot like, this is idiopathic. And they didn't say that word though. And so then my brain goes into asking different questions. And so what idiopathic means is it basically means we don't know. It comes from two Greek words, and now I don't know, I'm not going to say the Greek words right, but idios and pathos. So idios meaning one's own, and pathos meaning suffering. So basically saying, it's a disease of its own, or something along those lines. And typically when I have heard a medical provider use that term, it's to say, this thing is happening and we don't know why it's happening or where it's coming from. So, it's idiopathic, fill in the blank, whatever the issue is, whether it has to do with, your teeth or your liver or your brain or your gut, or fill in the blank, right? It could be anything. It seems to be something that just came out of nowhere and we don't know what it means or why. And we've done all the tests, and your tests or results or labs have all come back normal, and so that's why we can't explain why this thing is happening. And so I've heard that kind of verbiage. I have heard it come up in people's stories. You may have experienced something like this, where I'm experiencing something. I go to Dr. A. Dr. A maybe does some tests. They go, I don't really know. Everything here looks normal or good. And I'm going to send you to Dr. B because, that's in their area. Let's just say it's gut related. Okay, well, we're going to send you to a gastroenterologist, and they're going to look at stuff. Well, the gastroenterologist does their workup and their tests, and they go, I don't know what that is either. I'm going to send you to Dr. C, because maybe this is more blood related than it is gut related. What is that, a hematologist, I think? And so, Dr. C is going to do their workup, and they're going to look at stuff, and I don't know. And so you tend to get passed around from doctor to doctor, person to person, and specialists. They're supposed to specialize in their area. But what tends to happen, and it's not always happens, but it happens often, and I have witnessed it in many people that I know, family, friends, as well as clients that walk through my door. And that is to say, like, they don't necessarily look outside of their box. Like, here's my box, right? And I'm going to look at what's within my scope, my box. So if Dr. C has test results, Dr. B may not be looking at Dr. C's test results in the same way or at all. Now, hopefully you would hope that they are actually looking at those test results and looking at everything. But that doesn't always happen, unfortunately. Or what I have found to be more often, based on what I have experienced and what I have observed and what I have learned over the last decade at least, if not more, is that you may receive test results that from their knowledge and education may look what they call normal. but that doesn't mean optimal. So normal and optimal are two very different things. And when you hear a provider say, well, everything looks normal or everything looks good, I would ask, the follow-up is, well, is it optimal? And is it optimal for me? For example, I guess I probably should have looked this up before I started talking about it, but let's say vitamin D levels. I know from my recollection that a normal range for vitamin D levels is pretty large. So, 0 to 100, I think they will say that within normal range is something like 30 to 80 or something like that. So if I got my vitamin D levels tested and I was at a 35, they might say that I am within normal range and my levels are normal. But if you're looking at that on the full scale, 35 and 80 is also within normal. Wouldn't I want to be closer to 80? So in that example, from what I have learned, yes, you want to be at the higher end of that, not the lower end of that. But if that's what you're being told, right, your thyroid numbers, your hormone numbers, your vitamin D levels, the this, the that, the whatever numbers are normal, but really, they may be pretty close to not good or pretty close to not good in the other, too high, you may be experiencing problems. And that could be one of the reasons you're, in for treatment and you're getting results and you're wanting answers. So lots of factors to, think about. But one of the things that I've just noticed is that testing, and when people come back and say, well, I was told my test results are normal, I think there are more questions to be asked. And sometimes, unfortunately, we don't know what questions to ask. We don't, especially if we don't know what to look for. My question then, and my suggestion for you would be, okay, why? So if my vitamin D is low or not optimal, but within normal range, you might ask, okay, but what would be the optimal range? Or would a higher number make me feel better? Or why do you think my vitamin D is so low? Are there other things that could be contributing to my vitamin D being low? Let's say you supplement with vitamin D. Let's say it's the middle of the summer and you're outside all the time, and you're not covered up from head to toe, and you don't necessarily wear a lot of sunscreen. And so you should maybe have optimal vitamin D, but yet your vitamin D is low. You might want to ask, like, okay, like what could be happening that could be causing that? I don't know the answer to that question. Let's say it's winter and you're not outside and you're not necessarily supplementing, or maybe you are supplementing with vitamin D, but it's winter and you live in, say, Ohio, and the sun's not out all that much. And when you are outside, you're bundled up. And so when you ask, well, why would my vitamin D be low? I eat really healthy, but it is winter, so I'm not outside that much. Their answer might be, well, because we live in Ohio, you're not getting sunlight, and many people have to supplement with vitamin D because we're not necessarily getting optimal vitamin D from the food that we eat. That could be an explanation, but there could be other explanations. It would also maybe mean looking at other labs to determine why the things are happening the way they are. So I've talked in previous podcasts about some of like the testing that I've done. And so one of the things that I've learned even through that process is that, symptoms and the way we feel and the things that, we're eating and our test results don't live in a vacuum, and they're not like, separate things all on their own. So one thing leads to another thing, is connected to another thing, is connected to another thing, and they all are in this like intricate web. So if one thing is affected, it's probably affecting multiple other things in your life and potentially multiple other like factors or test results that you may be experiencing. So when your results show one thing that's off, there may actually be other things that are off, but we may not have explored those things. We may not know to look at those things unless they have some of that, other knowledge and explanation, or they maybe are trained to look at those things. I don't know, like lots of explanations. So I had like low copper, like a lot of low minerals, also low iron. And if we had just looked at like blood tests, we may have seen the low iron, but wouldn't have seen a lot of those low minerals because that wasn't tested. And so iron would have been, oh, here, let's give you an iron supplement. But I also did stool testing, and the stool testing showed that I had candida. And so the candida, something that candida feeds on is iron. So if I started taking an iron supplement, I may have inadvertently been feeding the candida and making the candida infection worse, while also not improving my iron, because there was that underlying factor. And unfortunately, those aren't things that many providers are looking at. They're not looking at underlying factors. They're looking at your symptoms. So when somebody says idiopathic, right, it's like, we don't know. I have seen this with numerous family members and friends with things like organ removal. There are, all of our organs are in our body for a reason. And I am still learning. So I couldn't just tell you exactly what each organ specifically does and what the harm would be in removing an organ. But you've probably heard, like your appendix, that's a useless organ. You don't really need it. Your gallbladder, your tonsils and adenoids. These are all common procedures that happen very, very often. Your uterus, for example, and oftentimes those can be considered unnecessary, maybe not quite so much the uterus, though at times, depending on the situation, can be framed in that way. But the other three, I've often heard talked about like, well, you don't really need it. Unfortunately, you do need all of those organs. They were in your body for a reason to play a specific role. Now, there are times where maybe the damage is too far gone in that organ, and therefore not removing it could cause more problems. But I also have learned that there are ways to heal organs and things if you know how to do it. And it's not usually a quick take a pill, fix it. It's usually some kind of lifestyle change, or there may be certain medications or supplements or certain things you may need to take in order to help to heal that organ, to get it to its optimal level of functioning. And then you will have to practice that lifestyle change in order to keep it optimally functioning. So when someone has a gallbladder that's full of gallstones, typically the recommendation is to remove the gallbladder. Now, I can't say for certain that you could get all of the gallstones out of your gallbladder, although in theory and from what I have learned over time, just in my own kind of research and health journey and things like that, that those things can be possible under the right circumstances, given the right guidance, taking the right things, can help for the breakdown of those gallstones potentially, or surgery to remove the gallstones versus remove the gallbladder itself. So now I don't exactly know, I guess, for certain that particular surgery is possible. But I do know that often the things you're experiencing can be healed or can be improved upon if the damage isn't too great. Now, there are times where the damage is really great, and making lifestyle changes, taking the right supplements, doing all the right things may not make your life better because the damage is already done. So, but it may be worth, exploring if that's something that you wish to maybe save as like an organ. But more often than not, I've just seen multiple family members go through experiences where it's like, well, your gallbladder's full of gallstones, we need to remove it. And nope, you don't really need to change anything. Unfortunately, that's also not true. Usually if you are removing an organ, there's certain changes that are going to need to be made because that organ played a vital role in something in your system. I know that, I've had, personal experiences where things have been done that were that I didn't find out about later. And the explanation was that like this was done for a specific reason, even though from what I've learned over time, that probably wasn't necessary. And from observation that, that was done by the doctor's choice. And so for me, that isn't something that brings me really good feelings and trustworthiness with providers when you feel like you've been lied to or manipulated into making a decision, or even unknowingly, something happening and then just being told that it had to happen when in reality it may not have. So I've seen that, I've experienced that. So, when we talk about idiopathic diagnoses, the questions that you can ask and the things you might want to consider is just, okay, well, where did this come from? Okay, if I have low iron, and you're wanting to give me an iron infusion, or you're wanting me to eat high iron foods, or you're wanting me to take an iron supplement, that's great. And when we do testing, is it up? Is it down? Is it staying the same? If it goes up and I feel better, but then we do testing a little bit later and it's back down again, why did that happen? What is going on that my iron isn't staying where it needs to, that I'm not functioning at a level that is optimal all the time? I shouldn't have to get iron infusions or take iron supplements if I'm doing all the right things. So tell me, doctor, person, how are we going to find out why the iron isn't doing what it's supposed to? So I go back to the kind of social media person. I don't know the whole story. I just catch little snippets. And I've had actually clients that have experienced similar things related to iron, and even myself, as I said earlier. And the questions that it came to mind for me was, okay, well, your iron is low. Have they looked at your stool? Have they done a stool test to see, do you have an infection of some kind? Parasites, some kind of infection, bacteria overgrowth, is something feeding off your iron? Do you have some kind of like bleed somewhere that could be, like an ulcerative or something like that could be stealing your iron? I'm sure there's other reasons why your iron may be continuously low. But if we're not asking those questions, if we're not trying to find out like where is that coming from, then you're going to continue to get those iron infusions without really understanding why it keeps dropping down further, afterwards anyway. Like if the one iron infusion doesn't stick and doesn't last, and you're having to do it over and over and over again, to me that says, okay, there's something else going on here that's causing it to not stay where it needs to stay. Are there other tests that we can do? Are you just not are you running these tests because they're covered by my insurance? What other tests might you run if it wasn't up to my insurance? What other tests might you run if you could have a choice and you could just run any tests you wanted? So we often find when I recommend my clients, if they want to use their insurance, so it's having them prepared to go in to ask about certain specific tests. If they want to get a hormone test, it's okay. I pull up other similar hormone tests that you can find from other types of providers, and they often might list the types of tests that are on, in a certain panel. And so I might say, here's an example of the hormones that you might want to have them look at. And then they can take that in and they say, hey, when you do a hormone test, can you do all of these? And not just, oh, we're going to run your estrogen and your testosterone and your progesterone. Well, that's 3, but there's a lot more than 3. And there's things that factor into those hormones. And so if you're not looking at all of them, are you really getting a full picture? Or are you just getting a little snippet, of the picture? And that doesn't really tell you exactly what the whole picture is. I've used that example in some of my presentations. Like if we just looked at the corner of a painting, you won't necessarily really get the full scope of what you're looking at. You pull out and then you see, that is definitely not what I thought it was going to be. And so that's what testing can do, is to really give you a full picture if you're really testing the full scope. I have recently been more aware of like mineral testing versus like blood testing. So, testing the minerals from your hair is different than testing potentially the minerals that are in your blood. A blood test is different than a urine test. From what I've learned, and this is very simplified, but a urine test is going to tell you what you're excreting, and a blood test is going to tell you what's kind of being retained. I know, very simplified. There's probably a lot more that goes into it, but if you're doing a urine test for hormones, that's going to look a lot different than a blood test for hormones, for that reason. But if you did both, then you're going to get more of a more well-rounded picture of what's going on, because you're seeing what's leaving your body, what's staying in your body, and what that has to do with anything. So when it comes to you hearing that word or hearing some of those other phrases, like it's an unknown origin or unknown cause, or it's undetermined, unexplained, there's no precipitating factors, anything like that, we just don't know where it comes from, but this is what we're going to do. If this is what we're going to do doesn't involve looking at like below the surface and looking for that root, okay, these are my symptoms and this is why I got the tests that I got, but where is that coming from? Do we need to do more tests to find out, right? It's that whole iceberg thing. When you go to a doctor, you're usually going because you've got these things that are happening above the surface, the symptoms that are presenting, the things that are causing you pain. But the under the surface stuff is what we really want to be looking at. We do the same thing in counseling. You come to counseling because all the stuff up top, the iceberg that's above the surface, is showing itself, right? But we want to explore that stuff that's underneath, that part of the iceberg that's hidden. What's all that other stuff that's going on that's causing the stuff above the surface to express itself? So when it comes to idiopathic anything, I encourage you to ask questions. Ask questions for yourself. Sure, do an internet search. The internet is not always the most helpful, but it can also be very helpful. Looking into other providers, seeing those topics from more of the alternative practitioners who are typically looking at those root causes or functional explanations as to why things are happening. And each of them may test or do things a little differently, but they're still looking below the surface and not just some of that surface level. Okay, you have these symptoms, let's treat the symptoms. You have a headache, here's a Tylenol, let's make the headache go away. But it's not saying, okay, but why do I have the headache to begin with? Where did the headache come from? That's what we're trying to do. You're having certain symptoms, so someone telling you it's idiopathic, we don't know where it comes from. If they're not exploring the why for that, they're not really treating the problem itself, they're treating the symptom. And that's what I like to try to avoid. It's not treating the symptom, but finding out where it's coming from. And so that's why I did more functional testing, to find out, why do I feel the way I feel? Where is that coming from? And what can I do about it? And I am seeing those results, and it's not a overnight fix, but it is happening. So, I'm happy to report that, it does work, but it does take effort and it does take time. And I have clients that, have been going through this for years and years and years, trying to feel better and be better. And, they can vouch for, like, I do feel better, but I still don't feel optimal. I'm doing all the right things, but it takes time for your body to heal. And the more you learn, the more you do. So, I hope you learned something today, and I hope you will join me again for our next session next week, and have a wonderful rest of your week.